Dr. Slawson is a graduate of the School of Medicine at the State University of Iowa. He graduated in 1962. He spent 8 years as a medical officer of the United States Army and has trained in both radiology and radiation oncology while he was serving in the Army. He ultimately served as director of radiation oncology at Walter Reed Medical Hospital. In 1971, he joined the facility of the University of Maryland, School of Medicine, Baltimore, Maryland, and remained there in the Department of Radiation Oncology until he retired 10 years ago. Although he still works at the medical school part-time, he is recently a master docent at the National Museum of Civil War Medicine in Frederick, Maryland. He lectures on Civil War medicine and related topics as outreach for the museum. He has presented and published several topics in Civil War medicine, including books on African American physicians and Civil War. Dr. Slawson is a member of the National Museum of Civil War Medicine, the Society of Civil War Surgeons, and the Society for Women and Civil War. Please welcome Dr. Slawson.
Thank you. Maybe as a preface, I should say I actually retired 14 years ago, sort of, but I'm still working part-time, so they can't get rid of me. I wanted to start out by saying welcome from the National Museum of Civil War Medicine. It's in downtown Frederick. If y'all haven't been there, this is the view of the building on Patrick Street. We're going to talk about African American physicians, particularly in the Union Army, and ignore to the extent African Americans were in the Confederacy. That's another topic that is a big debate. The whole story of African Americans in medicine actually goes back a long ways. Lucas Santomé is the first physician that I've been able to find out about in the United States. He actually practiced in New Amsterdam, which later became New York. He was a free black, had been trained in Netherlands, apparently. One of the people that I think is really important to think about is Onesimus, because Onesimus was a slave owned by the preacher Cotton Mather in Connecticut, and because of the concern of smallpox, he was asked if he had ever had smallpox, and he said no, but he'd had an operation. So he is actually the one who introduced the idea of smallpox inoculation in the United States. Usually the physicians involved get credit, but Onesimus is the one who brought the idea. It's about the same time that smallpox inoculation began in England, and from the same source, from Arab medicine. Caesar is a little different. He was a slave in South Carolina, and he invented a remedy for snake bite, and apparently it was thought to work because the South Carolina literature voted him an annual stipend as well as bought his freedom. I've read the description and I don't see why it works. James McEwen Smith, who this photograph is the first African American record to obtain a medical degree from any university. He wasn't able to get, he was from New York City, he wasn't able to get in any medical school in the United States, so he went to Glasgow, Scotland, and in 1837 he received a M degree there. He then returned to New York, where he practiced and was still in practice at the time of the Civil War. David James Peck is the first African American to actually receive a medical diploma in the United States from Rice Medical College in Chicago, and that was in 1847. It's 1 year before the first woman received an MD in this country, but it didn't receive all of the hoorah that Blackwell's diploma did. John Van Surley de Grasse is the second man to receive a medical degree in the United States, and we'll be talking about him later because he served with the Army, and that's actually the focus of the presentation. This is a list of people that I've been able to establish have received medical degrees. Now, it's true that most of these schools are in the North, although I mentioned that Chicago was one. Several were in Ohio, and I'm aware of one physician attending a medical school in Baltimore, although he didn't graduate from there. So these are the people that I've documented. Actually, when my book came out, it was the first time the documentation is in print that for anybody other than Smith having received a medical degree, and I've obtained this is hard information from the schools themselves. One of the people that I like to emphasize is, in fact, Rebecca Lee Crumpler. She actually is the first African-American woman to ever receive a medical diploma, and this was in 1864 from the New England Women's Medical College. After that, she went to Richmond when Richmond fell and worked with the Freedmen's Bureau. Much of the details of her work isn't known. She did write a book. Oops, hit wrong button, sorry. She did write a book in 1883 that was the first book that I've been able to find published by an African-American woman. It was on medical discourses. She died at age 62 in Boston. She actually returned, after she left Richmond, she returned to Boston and practiced there. I am unable to find any information about Crumpler, who was, she was married to shortly after returning from Richmond. This is the only known picture of Rebecca Lee. It's actually a medal that is in Philadelphia. The existing picture the picture it was made from can't be found at this point. In order to talk about African Americans in the service, we really have to talk about African American troops in general. The Second Confirmation Act in July of '62 authorized African Americans to be used in any way that was for the public welfare. Now, you see the term contraband on the slide here. Contraband literally means any property that is useful to the enemy in his prosecution of the war. And so with the Fugitive Slave Acts, any of the escaped slaves who followed the Union Army were supposed to legally be returned. But by calling them contraband, they were property, they weren't people, and they didn't have to return them. So it became adopted pretty much routinely. Lincoln apparently did not intend for, when he passed this act, when this act was passed in July, to have these people in actual combat, although there were combat units prior in the fall. There were units in Kansas, Louisiana, and South Carolina that actually saw action in the fall of 1862, even though the Emancipation Proclamation wasn't going to be passed in effect until January 1 of '63. This was the first official authorization of colored combat troops, and the first permission to raise a regiment was actually given to Governor John Andrews of Massachusetts, who was a very staunch abolitionist, and consequently the first unit that was authorized to start recruiting for was the 54th Mass. Now, the 54th Massachusetts was the first unit authorized, but it wasn't the first unit activated because it took a while before they got the troops. Incidentally, if you haven't seen the movie Glory, you should see the movie Glory. It's great. The book is better. The reality is much better than that. Actually, the sergeant major of the 54th was Frederick Douglass's son. It was probably the most educated regiment in the Union Army. Ultimately, there were some 180,000 African Americans who served with the U.S. colored troops, and that was the official designation. That one needs to step back. I'm married to a nurse, so I have to think about what the women did as well. These are the numbers that are documented for women, African American women who were working with the troops, with the Union Army. Now, in order, they actually compiled a list of all the women who were eligible for pensions, by which they had to have served at least 3 months, they had to have been officially recruited and officially signed in by the federal government. And they came up with a total of some 22,000 women who were eligible. This can't be more than half of the people involved because it doesn't include any of the volunteers. It doesn't include people who work for less than 30 days. And, you know, there were a lot of other agencies that had women working, doing the same work. But these numbers for African Americans are the only ones that are in this particular list. Again, I'm sure that it's a fraction of what really served. I estimate that that this number has to be at least 40,000. Yes?
What did matrons do?
They were in charge, the charge nurse, if you will, the chief nurse on the ward. And then, although I'm talking about the Army and having served in the Army, I'm partial to that way. We really need to remember that the African Americans were in the Union Navy. Of significance is that they started to serve in the Navy in the early 1850s, and the ships were not segregated. Any of the people who enlisted were serving on the same ships as the white people. It's true that many of them were in minor jobs, but at least they were in the same war with the rest of them. The numbers are something that's been very hard to come up with, but recently Howard University, the Department of the Navy, and the National Park Service did as detailed a record count as they could and came up with 18,000 men and 11 women. Now, we know there weren't any women on active duty at that time, right? Wrong. There were. It's interesting. The Navy had hospital ships, and in order to provide care in the ships, they needed nurses. Nurses were expensive, so they hired several African-American women and enlisted them in the Navy as cabin boys. Cabin boys got paid less than nurses did. So that's where those 11 come from. One of those 11 is, I think, very significant. Anne Bradford Stokes served as a cabin boy. She'd been born in Tennessee. She actually enlisted and worked on the Red Rover from January of 1863 to October of 64, so 18 months. She married Stokes afterwards, although most of her records are in Stokes's records, the way things got messed up then. And she remarried after that, and the interesting part of her story really is she applied for a widow's pension and was said to be ineligible because, of course, she wasn't married to Stokes at the time. But a little later, after she learned to read and write, which was several years after she was in the Navy, she actually applied herself, and in order to get it, she had to prove that she had been in the Navy and that she had served. So she actually was certified by the Navy as having served as a rating for 18 months. So she subsequently received a pension for her own military service. She is the first woman, not just the first African-American woman, the first woman to ever receive a military pension for her own military service. The medical officers are a small group, and I don't pretend are all that served. These are all that I've been able to find records of, and it's been a difficult chase. I can identify 12 men who served. 3 of these were as commissioned officers, a surgeon, 2 of them were assistant surgeons. One was promoted while he was in the service. The other were acting assistant surgeons, which was the officialese for contract surgeon. But many of them would wear uniforms as well and served sometimes in the hospital, sometimes with the units. One of the people we found, one college has 2 graduates, but I haven't been able to get the archives from that college. They are not where they're supposed to be. When the school folded and went under and merged with another school, the records supposedly left, except the people that were supposed to have the records have no record that they ever had them. I recently found another trace, so I may still be able to get them. But one of my 12 men only had 1 year of medical school, we know for sure. One of them, I'm not sure whether he's a graduate or not, and we'll mention him. So here's the list of the 12 people. Alexander, and we'll talk about each of these individually, so I'll just show you the names. Look at the commissioned officers first, since we always think we should come first, you know. Alexander Augusta was born in Norfolk, Virginia, born free. He tried to get in medical school, couldn't get in school, so he actually ended up emigrating to Canada. There was a large African-American population in Ontario, most of whom had been slaves, but some were freed. And he ended up graduating from medical school at the University of Toronto. And he worked at Toronto General Hospital for a while. When African Americans, when the U.S. colored troops were created, he applied for a commission. And so in April of 1863, he was the first African American to ever receive a commission as a major in the United States Army. He was commissioned as a surgeon, and the rank of that is major. Most of his service actually wasn't with the regiment to which he was assigned. He was on detached service. One of the places he served was in Camp Birney, Maryland, with recruits. But he was also in the Sea Islands in South Carolina. At the end of the war, many of the officers who had done well were given a brevet promotion. They were promoted as an honor, and he was promoted to brevet lieutenant colonel, which actually made him the highest ranking African American in the Army for many decades after that. When Howard Medical College opened in 1868, he was the only African American physician on the original faculty. And in 1877, he went into private practice in Washington. Died in 1890. He was the first African American officer to be buried in Arlington National Cemetery. David McCord was born in Kentucky, moved to Illinois. He graduated from the Medical College of Ohio. In 1862, he was commissioned as an assistant surgeon and then was promoted to surgeon. He was actually the first African American commissioned in the Army because his commission as assistant surgeon antedates Augustus. He returned to his practice after the war and died in 1874. John Van Surley de Grasse, I mentioned as the second man to get his medical diploma in the United States. He was a graduate from Maine Medical College, and many of you may know that Maine Medical College was related to Bowdoin College in Maine, where Chamberlain graduated from, and O.O. Howard, who set up the group. After graduation, he did as many people, if they could afford it, he went to Europe for a year or two and studied there, and practiced in New York when he returned from France, but then moved to Massachusetts. And while in Massachusetts in '63, he applied and got a commission as assistant surgeon. Much of his service was actually in the Sea Islands in South Carolina. He returned to Massachusetts after the war, and the governor of Massachusetts awarded him a surgeon's sword as a gift because of his service to the state. He died young. He died in 1868 at age 43. Now, let's look at our contract surgeons. Anderson Ruffin Abbott actually, although I said American, he wasn't actually born in the United States. He was born in Canada. His parents were both from the United States. And he had attended Oberlin College in Ohio, as many African Americans did at the time, because they were much more liberal. They also had a lot of women students where most colleges didn't. He apprenticed in Ontario under Augusta and attended the University of Toronto, hadn't yet graduated from there at the time that Augusta left, so he followed Augusta and applied for he wanted to get in the Army. He actually got a contract as a surgeon, served actually in Washington at what became the Freedmen's Hospital, now Howard University. After the war, he returned back to Canada, got his medical degree, and actually later became coroner of Kent County, Ontario. Benjamin Bozeman was born in New York. I don't know the date. In 1864, he was graduate also from Maine Medical College. And he was appointed an acting assistant surgeon. He apparently served in South Carolina at the time. And after the war, he stayed there. In 1868, when they reconvened a state legislature, he was one of the members of that Reconstruction legislature. In 1873, he was appointed postmaster for the city of Charleston, South Carolina. Cortlandt Van Rensselaer Creed is actually from New Haven, Connecticut, and was the first African American to get a medical degree from Yale University. He also, as many physicians were at the time, was an advocate of African American troops, and so he, in '63, got an appointment as an assistant surgeon and served with Connecticut troops. He returned to Connecticut after the war and resumed his practice. William B. Ellis graduated from Dartmouth Medical School, again in New England. I have really very little information about his Army service. He's not on any of the lists of commissioned officers, and that's very well documented. The lists for contract surgeons are reasonably complete, but there are a lot of people that we know of that weren't on there because the appointments were so iffy, and almost any physician or commander could appoint somebody for that. So, but we know that he served. So he probably was a contract surgeon. I don't have any, could not find any information for him after the war, and I wasn't able to find a picture. Joseph Dennis Harris was probably from Virginia, but this is a little indefinite. It's interesting, he was, as part of his anti-slavery efforts in the U.S., he was very much involved with the idea of having the African Americans emigrate and form colonies in different places. And he actually went to Haiti to look at some of the colonies there, became very unhappy with what was being done there, and went to Jamaica, ended up, he ended up getting, coming back to the States and then getting a medical degree. He spent a year in Ohio at the medical department of Wesleyan. That's Case Western Reserve today. And he served at a Freedmen's Hospital. All of the Freedmen's Hospitals were operated by the Army. The Army provided medical care officially to all of the people that were taken care of by the Freedmen's Bureau. So that would have been where he served. It's interesting, he stayed in Virginia after the war, and went the wrong way. I'm sorry, I'm discombobulated. There we are. He went to Virginia after the war and stayed in Virginia, and in 1869 he was a candidate for lieutenant governor. Unfortunately, he lost the election, but that number is probably the number of African Americans who were registered to vote at that time in Virginia. So it was clearly a one-sided. And I don't have a picture of him. William Powell Jr. Was born in Massachusetts, but grew up in New York City, where his father was actually a physician. Although I haven't been able to document whether his father had a degree or had worked as an apprentice. He attended lectures at the College of Physicians and Surgeons in London, and he said that he had graduated from there. He said he had a diploma, but at the present time there's no record of the diploma having been seen, and certainly it wasn't in any of his records. It is entirely possible that he attended a clear set of lectures and they just didn't give him the degree. That sometimes happened. It happened in this country as well for women as well as African Americans. But they would still have had to pay to go to the lectures. But he, at least when he applied for a contract, he convinced the people, and he was very knowledgeable. He was actually in charge of one of the hospitals in Washington. So somewhere he learned medicine, even whether we can find a diploma or not. He applied for a disability pension in 1891, primarily because of arthritis, but of course he wasn't eligible because he was never a commissioned officer. He was a contract surgeon. But he lived until 1981. I'm sorry, age 81. Charles Burley Purvis was a very prominent person. He was from a prominent African-American family in Philadelphia and very definitely into abolitionist circles. He received his medical degree actually right about the end of the war from Case Western Reserve and got an appointment as an acting assistant surgeon. And he actually worked at Freedmen's Hospital in Washington. In 1869, he joined the faculty at Howard Medical College as the second African American on the faculty, and actually was on the staff of Howard Hospital as well. Freedman's Hospital subsequently became Howard University Hospital. He was very important to the school. He spent some 54 years affiliated with Howard Medical College. John Rapier Jr. Was born free in Alabama, grew up in Alabama and in Tennessee. He did a lot of traveling, so his family was fairly well off. He traveled to Nicaragua, Haiti, Jamaica, and actually while in Jamaica, apprenticed as a physician, came back to the States and matriculated at Michigan Medical College, and he only stayed there 1 year. And then, as many physicians did, as students did at that time, he moved to Iowa College of Physicians and Surgeons in Keokuk and graduated from there. He was the first African American to receive a medical diploma west of the Mississippi River. He, like many others, was a contract surgeon. He served at Freedman's Hospital in Washington. Unlike the others, in 1866, he died in Washington while still on active duty. Bilious fever is anything that, it's a very vague term that implies upset stomach and bile problems. You know, medical terminology in those days was not clear to many of us even today. Alpheus Tucker was born in Detroit. He had also attended Oberlin College, and he started medicine at Michigan at the same time, at the same time that Rapier was there. However, he was forced to leave the school because of a student revolt. The students were willing to accept a Jamaican, not realizing that Rapier was from the U.S. initially, but they wouldn't accept an American-born African as a student. So he followed Rapier to Keokuk and graduated there. He served as a contract surgeon. We know that in 1869 he applied for membership in the Medical Society of the District of Columbia, and actually Purvis and Augusta applied at the same time. Their credentials were reviewed by the Medical Society. They were judged to be complete and adequate, but they were not approved for membership. But like many of the others, Tucker did end up practicing in Washington anyhow. I do not know when he died. Sorry, I have no picture on him either. There's one other man that we should talk about as part of this, I think, Martin Robinson Delany. Many people will tell you Delany was the first African American to be commissioned as a major in the Army, but that was a major as a line officer, and it was a year. It was almost 2 years after Augusta. And he was born in Charleston, Virginia, Charlestown, Virginia, of course, now West Virginia. Grew up in Chambersburg and then went to Pittsburgh. He had apprenticed himself as a physician and a dentist and actually set up practice. In 1850, he was accepted at Harvard Medical School. There were 2 other African Americans and 1 woman who were accepted that same year. And these very liberal students of staunch anti-slavery country in New England revolted and refused to allow. They said they didn't have to go to school with these people. And the dean of the medical school was forced to tell these people they would not be allowed to graduate. So like the others, he only spent a year at Harvard. He returned to practice briefly, but he again was interested in emigration and felt that creating colonies would help. He actually took a colony of African Americans to Nicaragua, but the effort failed, and he returned to the States, got involved with another group and went to Africa, to Liberia and to the Congo to look for suitable areas for colonization. In 1863, with the Emancipation Proclamation, he was hired to recruit for Rhode Island and Massachusetts for their U.S. colored troops. He was a strong advocate for U.S. colored troops having colored officers. I didn't say earlier that when they created them, the Secretary of War declared categorically that they should have only white officers. There were a few chaplains and docs, as we talked about. There were actually a few African Americans who served as officers, some before, but very few survived 1863. But finally, in March of 1865, he convinced Lincoln to create a regiment with colored troops and colored officers, and he was commissioned a major at that time, as I said, 23 months after Alexander Augusta. But then the war ended and nothing came of this, and there weren't any more colored officers in the Union Army for some time after that. Delany served, stayed in South Carolina after the war and served in a minor post in the Reconstruction government. He sort of dropped out of the public eye after that, primarily, I think, because he supported Wade Hampton as governor of South Carolina in the early 1870s, and Hampton was one of the people in South Carolina who turned a very liberal, effective state to what it had been before the war. Now, I've labeled this slide medical epilogue because this is the Howard Medical Faculty from 1869 to 1870. General O.O. Howard, who you may know is the one who was appointed the head of the Freedmen's Bureau, and he and the Freedmen's Bureau opened Howard University in 1867. And then in 1868, they opened the medical school. This is General Howard here. It's interesting, he's standing this way. You can't see that this sleeve is empty. He had had an amputation of an arm early in the war. So that's where I am. Actually, I wrote a book on the subject. It's not a large number of pages, but it's the first documentation of a lot of these people as medical school graduates. Some of the information in the talk I've gained since since that was published, but hopefully when we'll be able to do a revision and get more information. I'm sure there are a lot of other African American physicians who served as well, and maybe people listening to talks like this or seeing the book will stimulate them to make them public knowledge. There has been a lot more information on a lot of the people available on the internet since I started looking at the issue. Thank you for allowing me to exercise my addiction in Civil War medicine.
Folks, we have time for questions. Was there anything like a standard medical school curriculum before the Civil War?
Sort of. The answer is yes, but no. Or no, but yes, I forget. Most of the schools by 1830, most of the schools had about 4 months of lectures, 5 days a week, and even exams on Saturdays. They only lasted 4 months, and then they repeated the same curriculum the following year with the usual subjects. But the original medical schools in this country were set up to augment the time that the person spent actually learning medicine from a practicing physician. So they were still supposed to do this same sort of thing. By 1860, two-thirds of all of the physicians in the country were medical school graduates. Some of the schools at that point had longer school terms. Things were gradually turning. It wasn't really a standard, but that was the basis that the federal government used as saying that, okay, this is a trained physician.
Hi. I have a quick question. You list 3 commissioned African-American surgeons.
Yeah.
Can you tell me how you made a determination that David McCord was African-American?
We've had this discussion before, haven't we? I have it because I found, when I found the statement that the report of his being commissioned, it said of African descent.
Well, my question is that I've done a lot of research on African-American surgeons also along
Yes,
with
I know.
Dr. Slawson. And my belief is that the reference to of African descent was relating to the first, I think it's Louisiana Volunteers. Because my question is that the reason why I question that is because I did not find anything in any of the records that indicated it. So, and the other thing is, based on the research, how did you determine that all the others were African American in comparison to Dr. McCord? Because, as I mentioned, it seemed unusual in the orders that were from the American Medical Times. They never made any mention of anyone's race in anything.
That's
so.
the only record I found that said anything specific.
Right, and my take is that it was referring to the regiment that he was and not to him himself, because in the other orders that are listed for Augusta, they never mention anything about his race. So that I didn't know if you had found any other evidence.
They did when he had his initial examination.
Right, but I was talking about the actual orders, so that's why I was curious, because I didn't know if you had found any other
No,
evidence that indicated
I have
that.
no other information.
I was wondering if the black surgeons were able to operate on both black and white patients.
Actually, it wasn't commonly done. The black surgeons that were with the Army were with African troops or the freedmen, and it wasn't. It was expected that they would not. Of course, technically they could have, and when they abroad they often did, but no, it was understood that they would only be treating African Americans. Actually, Augusta was, when he at his regiment, he was assigned 2 white assistant surgeons, and they objected very strongly serving under an African American. And that may be why he was put on detached service so much, but he never was removed from the title of surgeon for that particular regiment. So even serving under an African American at that time would not have been done. Yes?
A lot of us are aware that many African Americans would pass in this country. Is there any chance that, or do you have any evidence that of African Americans who passed to secure their education?
I'm sure it's happened. I know that one of Thomas Jefferson's grandsons served with a white regiment from Wisconsin, and there certainly the Smith family after 1860 were listed as white on the census rolls.
Hello, hi.
Hi.
I wonder, are any of these men, do they still have descendants that are alive today?
Yes, I haven't spent a lot of time looking at that, but there are, many of them do have descendants. I know that About 9 months ago, I found a website that talks about Creed family. There was a family reunion with both supposed black and supposed white people coming, as the same as one could say for Thomas Jefferson's descendants. There were groups from both sides. So yes, some of the people, some of them still have. I haven't spent a lot of time looking at this aspect of thing because my interest decreases sharply once Civil War medicine is displaced from the scene.
Martin Delany has family right here in town.
Yeah.
Well, first of all, I'd like to thank you for your efforts and what you've done. But in your research, did you find anything about the rendezvous hospitals? Because a lot of, due to prejudice, black soldiers and white soldiers weren't treated, of course, equally. There were times when they were taken to different locations to even be treated. Did you find anything about the rendezvous hospitals that were established? Because it was my understanding that a lot, and especially the contract surgeons, served at those rendezvous hospitals or rendezvous sites.
Well, the part of the problem in looking at hospitals and hospital sites at that point is that the terminology varied so much in the recorded terminology. I agree that the whites and the blacks were not cared for in the same hospitals. They were not cared for by the same peoples. But the standards for the medical care that the Army required was the same. On paper, it was the same for both. And I think most of the responsible people tried to do that. It's a big problem that's a lot more time than we can take at this point. But I acknowledge that they were not treated in the same facilities. That wasn't the focus of what I was trying to, when I started this, I was trying to prove that there in fact had been medical school graduates before the war, which even a next door neighbor of mine who about my age, actually a few years older than me, who practiced in Washington was unaware of this. So that was my goal in putting out the book.
Thanks again for your presentation, Doctor. I guess I was curious if you had shared your information perhaps with other museums across the country, perhaps particularly the American History Museum or the upcoming museum down the street on the mall, the African American History Museum, to kind of get
I haven't
information more out
personally, but I know that when the book came out, actually the book was published by the National Museum of Civil War Medicine Press, and they sent flyers to all the museums that existed at that time that they thought might have an interest in it. So it's certainly freely available. If anybody's interested in the book or more information, it's I'm a volunteer of with this place, and they're the ones who published the book. And if you contact them, you can get information on how to obtain the book.
Well, you can also obtain the book today. There is going to be a book signing immediately after the program.
Thank you.
15% off. You got that?
I also wanted to thank you for your long years of research. I wanted to know, how long did your research take, and what motivated you? What was your interest in identifying this subject area?
The last part of the question is easier to answer. Keeping track of time and the way things change is difficult. But I attended a lecture that was given in February of one year where somebody maintained that there were 8 African American medical graduates. I had just completed a paper on medical education in the United States prior to the Civil War, and all of the authorities said there were no place of African Americans in medicine prior to the Civil War. So when I was told there were 8, I started out to see, is he right or can I prove him wrong? And instead of the 8 he talked about, there are 12 or 15, depending on where you come up with the numbers. Interest. I don't know how long it took. From the time I first started looking, the first talk that I gave on the subject was probably a year and a half. But, it was a lot of, most of my research has been done by the internet, but there are a lot of very, very helpful archivists and librarians around the country who are really, really very helpful with this material. But I really can't say how long it took.
Thank you for your program. I've got your addiction as well, but my addiction is to the First World War.
Yeah.
So I have 104 African-American physicians that we've been researching for almost 10 years now.
Mm-hmm.
My question is, when they use the term surgeon, physician and surgeon, are they used interchangeably?
When I give a talk on medicine in the Civil War, one of the things I emphasize is that surgeon was a title. By definition, any physician serving in the Army or the Navy was a surgeon. Specialization into internal medicine and surgery and really hadn't been done yet. Much of that came as an outgrowth of the war. The only specialty organization that I'm aware of prior to the war was the American Society of Ophthalmology. It was actually founded in 1859. But, surgeon, actually most of the physicians in the Army spent most of their time as physicians because the surgery was only a small part of the work done. 2/3 of all of the patients dying during the Civil War died from disease not related to battle injury. So that's what they were taking care of.
I have one other follow-up question. Yeah, you mentioned a Robert Leach as being one of the people in your list.
Yeah.
There was a Jesse Leach who was also an African-American physician in the First World War. Do you have any idea if they might be related?
Where was he from?
Nashville, Tennessee is where he trained. Okay. I think he was originally in, I can't remember where he was born.
This guy was in Washington, I believe.
Okay. I'll have to check that out.
Yeah.
Thank you.
Mm-hmm.
Hi, thank you very much. I also wanted to kind of piggyback on everyone else. I greatly enjoyed the presentation. The question I had was, after the majority of the African-American physicians doing at least 1 year in Harvard and these other institutions, are you aware of any acknowledgement of their service or their tenure at these institutions since the Civil War or even now in the 20th or 21st century? Have you been in contact with anyone who said, yes, these people were here for a year and we acknowledge their service?
I have not. I know that they were specifically told they couldn't graduate. Actually, the woman who was involved left immediately. The one of the 3 men ended up going to another school and graduating. The dean of the interestingly, I think, the dean of the medical school at Harvard at that time was the poet Oliver Wendell Holmes, who is one of the, he also wrote a poem on the stethoscope to emphasize that it was widely used at the time of the war, before the war. But he was dean of Harvard for several years.
I was just wondering, the black troops that fought for the Confederacy, if they needed medical treatment, what did they do? If you have any idea.
I stayed away from the issue of black troops with the Confederacy on purpose because it's such a debate. How many combat troops were there with the Confederacy? And the estimates vary anywhere from a few hundred to maybe as many as 50,000, and nobody can say with any certainty. And I think that's, but they obviously anybody who was there was cared for, got care either from their friends, their co-soldiers, and sometimes from the physicians as well. Because even, the plantation slaves were, to some extent, their medical care was at least overseen by white physicians. So there would have been the same route.
The one thing I just wanted to kind of
Yeah.
piggyback on what you said is that, from what I understand, there were no black surgeons that worked in Confederate hospitals or
Not
with
that I'm
Confederate.
aware of.
But there were African-American women and men that worked as nurses.
Oh, they were a major
And
part of the
so-
nursing force.
Right, and especially at Chimborazo Hospital, where they had like hundreds of African-American men and women, and most of them served, they were deputized or sent over by their plantation owners, but there were some free
Mm-hmm.
African-Americans that worked in Confederate hospitals, especially in Richmond.
A note to that was that when the gentleman asked about the black troops in the Confederacy, that was the primary source of the only two companies that can be truly documented of African Americans serving in the Confederate service. They came from Turner and Chimborazo Hospital in Richmond. Majors Pegram and Turner were associated with that, and they recruited from Chimborazo Hospital. But other than that, the quote of 50,000 or whatever, you have to think about how late that was in the war when the Negro Soldiers Bill was passed in March of '65. You have to remember, too, that the Confederacy was literally broke in '63, that they could not have possibly mustered, uniformed, equipped 50,000 troops in March of 1865 with literally 30 days left in the war. They could barely feed and clothe their own troops at that point.
I don't think anybody suggested that there were 50,000 that were recruited, fed and clothed at that period of time. I said some people have said as many. But you see, the thing that regularly makes it muddy is a lot of African Americans accompanied their masters, their family, to the war. They provided nursing care, they provided they were servants for that as well, and they were often involved. Many of them carried weapons. What do you call somebody who's firing back at you? Is he a combat soldier, or is he just there? And we know for sure that many of the Confederate troops never got uniforms. So I'm not arguing one way or another, and I don't know how many. I know there were some, and that's the only answer I have.
Absolutely, because it can be debated, like the gentleman wanted to discuss the terminologies of today's military and apply it to 19th century military. The big difference is that the soldiers of today are trained primarily as combat soldiers regardless of their job. During the Civil War, you couldn't technically call a teamster who worked out of the quartermaster's department a soldier, and it's verified in the Confederate pension records that they were not soldiers.
Well, in the Civil War, 90% of all of the Army were combat troops. In the present Army, less than 20% are combat troops. It's all support troops. Things change.